tonight we're very honoured to be learning more and be encouraged by stories of people much more distant, much closer to us, much less distant. And I'd like to invite Dr. John Oakley to speak. And John, I'll hand over to you, and you're very welcome to share your screen as you see fit.
Thanks very much, Michael. Good evening, everyone. So this presentation is really the story of the PNG Health Care Manual 3rd edition, and with a particular mention of the key part that HealthServe Australia has played in this project. There have been many partners and many key people, and all of them were essential for the project to happen, but HealthServe Australia played a particularly key part, as we'll see. Okay, so by way of background, Papua New Guinea is Australia's nearest neighbour, just to the north of Queensland, and it also fronts a border with Indonesia and a border with the Solomon Islands in the east. Papua New Guinea has over 8 million people, similar to the population of New South Wales. You're going to see a series of 8s here. About 80% or more of people live in rural communities. Most of them are subsistence farmers with an income of less than $8 Australian a day. 80,000 people per doctor in rural areas. So there's a massive shortage of doctors overall in the country, and those that have been trained are mostly in the big cities and the big towns. And in rural areas, yeah, it's an average of about 1 doctor per 80,000 people, which is totally inadequate. It'd be like if you imagine the city of Sydney with 4 million people and only 50 doctors. That's including hospitals and GPs and everything. It just, you would have no chance of seeing a doctor. And that's the situation in rural communities. Yet PNG is only 8 kilometres from Australia. The border between Australia and PNG is the border in the world with the greatest disparity of healthcare standards across it. Dr. Cliff and Judy Smith served in healthcare in Papua New Guinea for many years, last century. Cliff was commissioned to write the 1st edition of the Healthcare Manual as a training and practice manual for remote healthcare workers in PNG. The 1st edition was published in 1988, and he followed with a 2nd edition in 1996, which he had to write while he was busy working as a GP back in Australia. And these two editions, this book has been an immense treasure to the people of Papua New Guinea. You'd find old, much loved, much worn, dog-eared copies of it in remote facilities where it's been the main training and reference work for remote healthcare workers. If you get sick in a rural area, as I said, you're not going to see a doctor. You're most likely to see a community health worker. And what they know, they've learned from this book. In 2007, Cliff and Judy met with Rosalind Kopas from Osvoc Publishing. Rosalind had been involved in the publishing of a new curriculum for CHWs in Papua New Guinea in 2006. And while doing this, she'd recognised the great value of the healthcare manual. But she realised that it needed a major update. So she reached out to Cliff and Judy, and together they hatched a project to develop a 3rd edition. But this time, enlisting a group of PNG writers to contribute content. Cliff was the commissioning editor. And HealthServe Australia initiated this project with support for Cliff as he went up to PNG to gain partnership and support from the Department of Health in PNG and Christian Health Services and other organisations. And he appointed the Baptist Union of PNG to be the lead agency on this project. It was a huge project and a complex one. These were the major partners that came together to make it happen. So within PNG, there was the Baptist Union of PNG, the lead agency, the National Department of Health, Christian Health Services, which is the coordinating body for all the church health services in PNG. And the church health services deliver the bulk of the healthcare in rural areas. The Church Partnership Program in PNG was also a key partner. In Australia, HealthServe Australia helped with initiating the project. Oswald Publishing provided all the technical expertise and much of the hard work that made it happen. And Transport Aid International, otherwise known as Baptist World Aid, were key partners, particularly in establishing funding through the Australian Department of Foreign Affairs and Trade. So Cliff, to make this happen, Cliff had a lot of networking to do. He, by 2014, he had a lot of agreement from all these bodies that this was a worthwhile project, but still no one had committed funding apart from HealthServe. Then in late 2014, Cliff was diagnosed with advanced cancer in the liver and given only a few months to live.
Okay.
He contacted me and asked me to take over the role of commissioning editor. I was in shock to hear of his illness. Cliff had been a good friend, a mentor, and a role model for me, and probably for a number of you listening tonight. I'd been hoping that Cliff would ask me to write the snakebite chapter and maybe one or two other chapters, but the thought of editing the whole manual was a huge shock to me. But after a few weeks of prayer, talking with wise friends, I felt God was laying this on me as a challenge, a mission, though I felt thoroughly unprepared, having never published anything in my life before. And so I became part of the team. I had to go up to PNG and meet all the stakeholders and try to get their confidence and commitment to make the project go ahead. And thank God it did. So one by one, the Baptist Union, the Christian Health Services, Department of Health, Church Partnership Program, Department of Foreign Affairs and Trade committed real money to the project, and it launched in 2015. Baptist Union of PNG really grabbed the ball, a 20-minute promotional video. I've just selected 3 minutes of this to show because it sets the background for the project. Here we go.
What you doing?
Baptist Union of PNG, commonly known as BUPNG in short, is a non-government organization fully managed by PNG citizens and has been operating for 35 years.
Our main purpose is to spread the gospel of Jesus Christ. And on our logo, you will see that believing God and serving holistically. As we see today, the health problem in the rural and remote areas of Papua New Guinea is unattended. And the community health workers, they play a very key role in those rural aid postings, and where there's no road access, and most of our people live there, and they provide services to them.
I'm an Australian GP working in remote rural health in Western Province since 1981, mostly at Whanganei Rural Hospital and Community Health Worker Training School, but also at Tabubil Hospital and helping a bit at Kiunga and Ballymore hospitals. I've done extensive patrolling to remote rural communities and health facilities, and for years provided radio and telephone support to community health workers in remote places. I'm passionate about improving health services in rural parts of Papua New Guinea. The community health workers and nurses in these remote facilities are my heroes. I want to do whatever I can to support them. More than 80% of people live in remote places. Many of these find it hard to get to healthcare, and if they can, they're most likely to see a community health worker. They are the front line and the backbone of our health services. Dr. Clifford Smith's Health Care Manual has been the training text and reference book for CHWs for 30 years. But now it's 20 years out of date and it's out of print. Before, CHWs could study from this book during their training and then take it with them as their reference book when they went out to remote places. But now there are only a few copies left in library shelves. More than ever before, there's a great need to train community health workers, and updating this reference book is a key strategic part of this process.
The Healthcare Manual project officially commenced in 2015. We're excited to tell you the project has made good progress in the first year.
For me, the size of the task is daunting, but I know that for the sake of the people of Papua New Guinea, it must be done. Thank God, with a lot of help, it was done. We worked very close with stakeholders in PNG. We had regular meetings with all the stakeholders. I just particularly want to mention Jerry Colmer, who worked with Cliff and Rosalind and I right from the early days of the project as a project manager and advisor for us. And yeah, she played a key role. And also Joyce Malepia, who was the project manager in PNG for most of the project. We also had regular meetings with the technical review panel. This included 2 WISE community health worker training school principals, a public health expert, a paediatrician, an obstetrician, an emergency physician, and a general physician. We regularly reviewed chapters, and they helped Rosalind and I get the direction and content right for the book. They were an amazing team, really inspirational. I particularly want to mention 2 people. Firstly, Ray Cry, who was our public health expert, who wrote many of the chapters in Volume 1 and also helped to set up the framework for Volume 1, the community health volume. And also Dr. Al Maha, a senior physician. He wrote a number of excellent chapters and was a key advisor on many of the others. We had 92 contributors, some writing chapters or contributing drawings or reviewing chapters or giving advice. And the majority of these were people in Papua New Guinea, many also from the Department of Health. And I think this was part of the design of the project, was to involve these people and give them experience in writing and in the whole publishing process, in the hope that down the track they would be able to continue this process for the next edition. So Volume 1 is called Supporting Healthy Communities, and that's the community health information that's needed. The role of a community health worker is not just putting band-aids on, but also working with the community to help the community develop a much healthier way of living. So there's a lot of educational information in there. And Volume 2 is the clinical volume, where it covers everything from emergencies to maternal health care, pediatrics, the whole range of diseases that are commonly met in PNG, 4 new chapters on mental health, palliative care, and other new content. So finally, it was printed in September 2019, and here's Judy Smith, the proud owner of one of the first sets off the print press. It was a great joy to her and to all of us to see Cliff's vision come to fruition. It was an answer to so many prayers and a fulfillment of much hard work. Well, when we were ready to print, the money had basically run out. And that's where HealthServe Australia jumped in again to raise funds to get the printing done. DFAT helped, and HealthServe Australia supporters and friends and family all chipped in, and we were able to get enough funds together to print 2,000 copies, get them shipped up to PNG and distributed to the community health worker training schools. This is the graduates at Rungane Community Health Worker Training School from 2019. So they actually didn't see it themselves. The next lot did. So this was a tremendous boost to the training schools. They were very happy and excited to get them. But we still needed another 13,000 copies for the working community health workers and for backup supplies for the training schools for the next 5 years. So Transform Aid International and BUPNG worked hard on this with the Church Partnership Program and the Department of Foreign Affairs and Trade, and were able to come up with the funding so that another 13,000 copies have now been printed and shipped to PNG. And I was very excited in my recent trip up to PNG to see the distribution actually starting and getting going. So I was at Barlymore doing some training with some health workers there, and we were able to receive delivery there by Mission Aviation Fellowship, 78 sets of their healthcare manual, which would then be delivered from there as a base by MAF and the Aerial Health Patrol program I was working on to remote communities in Western Province. And this photo is from Amity Health Centre last week. Amity is one of the most remote health centres in the country. YWAM Ships has got involved in the delivery of these healthcare manuals, and they went to Amity and distributed them to the health workers there. And you can see them getting very interested in opening up and having a read. Other partners involved in the distribution with BUPNG, MAF, Missionary Aviation Fellowship, PATH, which is a Department of Foreign Affairs and Trade initiative working in PNG to assist the provincial health authorities with distribution. So they've taken this on as part of their work to strengthen health services in the provinces. The Kokoda Track Foundation are assisting with distribution in Oro Province, Total Oil Company in Gulf Province, etc. Getting things done in Papua New Guinea involves networking with whoever on the ground can be of assistance in the different parts of the country. And Baptist Union are doing a good job of engaging with that network. So for me, it was just very exciting to see this actually happening, to see the end game of the project, delivery to the frontline workers. During my time up there, I was training healthcare workers who were going out on patrol. I was actually training them from the healthcare manual to teach the healthcare manual to the health workers in the bush, to help them to open it up and read it and understand it and use it. So that was very exciting. I want to give a big thank you, firstly to Cliff and Judy for all their initiative in the background before this project really got working. I want to thank Rosalind Kopas and her team at Osvok Publishing for their amazing professional expertise in this area and all the hard work they did. For Jerry Colmer from Terrigal Uniting Church, and also Terrigal Uniting Church, who also provided key support at key times. For the Baptist Union of PNG, who are really passionate about this and running with the ball. Christian Health Services, National Department of Health, and the Department of Foreign Affairs and Trade, who've ended up providing the bulk of the funding. Particular call out to Ray Cry in Papua New Guinea and the other contributors and encouragers who made it possible. But particularly, I want to thank HealthServe Australia for the invaluable support you've given at key stages of the project, getting it started, getting the first print done, but really helping and encouraging us all along the way. Most of all, I give thanks and praise to God, who brought all these people together and enabled us to make it happen.